Thank you, Amandeep, and welcome everyone. So we are here today to discuss a really interesting topic, the use of AI, multi-omics, to move from healthcare to health. So what do we mean by from moving from healthcare to health? Traditionally, we've always been treating disease, but now we realize that it's really important that we prevent disease. Now, we've heard over the last few days about this from a very personal perspective on how it's really important for individuals. I want to open this session up by saying it's actually even more important for health systems. If you look at the NHS, which is a system very dear to my heart, a large part of my family work at the NHS, the system, with as much as we love that system, is having its challenges. We cannot cope with the number of patients coming through at the NHS. And the need to move to a healthier population is imperative, because whichever healthcare model you look in the world, unfortunately, they're not doing very well. So we've got these wonderful panelists who are going to try and unpack this for us. We're going to talk multi-omics, which is the new thing, buzz around the world. AI is all over, everywhere we speak. So let's try and unpack this a little bit. Dr. Vidya, could you give us a brief overview of what multi-omics actually means?
Hello, good morning everybody. So multi-omics is a field of science where we study at each different omics level, like starting from if you see the central dogma, the information flow, like a genomics, transcriptomics, like mRNA expression, to the protein level, proteomics, to the metabolite level, metabolomics, and also all the other downstream omics, like exposomics, like what is the influence of environmental pollutants, that is called exposomics, or gut microbiomics, like what is the influence of your gut microbiota on the health of the host, like our human bodies. So pan multi-omics or integrated omics analysis is how we can integrate all these different layers to understand at the holistic systems level. That is, in brief, is multi-omics.
Thank you, Dr. Vidya. Just to augment what she said, genomics is the study of all the genes in our body. And as most of you know, your genes are quite static. So that's what you're born with. Then you move on to studies of proteomics and metabolomics. Those become more dynamic, and they become a very important part of our conversation, because genomics can predict your risk of certain diseases as you're born. But there are other factors which are more inundated with how you interact with the environment. And Albarah is an expert on that topic, so I'm going to throw that to Albarah. Albarah, could you unpack genomics, epigenetics, methylation, what that means in that journey from healthcare to health?
Thank you, Sid. I'm far from an expert, but I'm passionate about the topic. That's the difference. But yeah, so if we, to Vidya's explanation, if we look at the genome as a static map, 3.2 billion data points, 23,000 genes. We only understand the exome components typically in the clinical domain. Very small portion of the genome, 1 to 5%, is understood and applied in clinical applications. Now, the genome then translates and codes into our proteins, the proteomics. Now, that is what then makes into the metabolomics, which all makes our functions in our body and all the rest of it. To do that, there is a component of a switch that turns a gene on or off, what we call methylation. So if if this component or this turning on and off is impacted by an external stimuli from the environment, this could lead to a potential disease. Now, there is many studies that show causal agents, environmental causal agents to disease, but there's a lot of unknown environmental causal agents to disease. Now, where we're fortunate at M42 is that we have a significant amount of environmental data. We have a significant amount of genomic data. And if we look at the epigenetics, that translation of genome to proteins, we can then start looking using AI, which is a key component here, because the data set itself is so vast, it's humanly impractical to be able to analyze this data in a methodical manner. Using AI, we can start looking at environmental causal agents of disease, new environmental causal agents of disease, and therefore proactively predicting disease, proactively managing disease, and managing the environmental stimuli causing that disease as well.
Thank you, Albarah. And just to add a little bit more, so traditionally when you look at multi-omics, what you're able to get is a readout. And how do you translate that into risk scores and integrate multi-omic data sets is where AI can really increase and facilitate that journey. Laurette, we've been quite fortunate here in the UAE to have an Emirati genome program which has sequenced almost 1 million people. That is not a possibility all across the world. So how do you take sub-cohorts of populations which have been sequenced and analyzed and make population-level predictions that can benefit an entire nation and probably transcend country borders to the world?
Thank you very much, Sid, for your question. So when we think about epidemiology, it's about the study of health trends and diseases within large populations. And we think about omics adding another dimension to us understanding the kind of associations that we tend to see when we do epidemiological research. So looking at exposure disease outcomes, disease progression, and disease outcomes themselves. So thinking about the role of omics in how we can understand what's happening at a cellular level, it help us to explain what we start to see at a population level. And we can start to apply these very new methodologies, including AI, to really develop our understanding and our ability to predict and detect diseases, understanding how the environment and how the genetic makeup of a person can moderate their risk for developing certain diseases, and also why we have disease progression at accelerated levels in certain populations compared to others. It really offers us another lens, another view of how we can start to predict and prevent diseases.
Thank you for that. Javi, just building on what Laurette said, now, we've got a data set which has got methylation on it, but it's not for the entire population. Obviously, going forward, we want to add other multi-omics into the mix. How do you see what you have from that methylation data to really make insights for the wider national population in the UAE?
So methylation is way less known compared to genomics, both at the genome-wide level and at the population level. So because of that, this lack of understanding, those 80,000 plus genomes that have been sequenced with methylation data available, we will create like a map, which is what we're trying to do with the Abu Dhabi DOH, like a map that spans the whole genome and also the population at the different ages that we have. And with that, you can derive insights that maybe you can apply to other populations that have not been sequenced with methylation. That knowledge that you gain, you can then apply it to other individuals that have not yet methylation profiles.
Okay, thanks, Ab. Vidya, coming back to you. So you've got these insights. You're able to tell people that you're risk of certain disease. Now, there are two ways to analyze this. One is through the clinical health system. And as I mentioned in the opening, the challenge is that the health systems today are overburdened with the amount of disease that's coming through the doors. So how do we empower individuals to take control? And very specifically, the challenge is, and what we're seeing is, as much as you can give people information, how do you make sure they act on that information and just not think that, oh, this is just another piece of content that's coming to me? So what can we do to make individuals really act on the information we're providing them?
Sure. So if you see, the precision medicine is evolving from, reactive disease-centric approach to proactive, wellness-oriented models, all enabled by integration of artificial intelligence and multi-omics analysis, so that we are able to predict what are the high-risk profiles long before the clinical symptoms appear. So coming to your question, how do we empower patients to utilize and absorb this information? So here, health literacy plays a crucial role. For example, patient education, if we can explain them what is the meaning of genomic risk and how they can utilize data-driven care and prevention strategies and lifestyle and nutrition interventions, they can make informed decisions, right? And then they can trust what we are telling them to follow. And if there is a more engagement from the patient side, they can be ownership, they can take the ownership and much more engagement in their care journey, which is currently lacking here. So here, the education is much more important, in my opinion.
Okay.
If your question is only to the patient level.
You can augment that by what do you think, how do we go in and have the clinicians respond as well?
Yeah, okay. Then if that is the case, continuing medical education is very crucial for physicians because, currently it is rapidly evolving, right? If both patients and physicians, if they don't understand what is the genomic risk, what kind of interventions we are suggesting, then both are, they are not able to utilize the insights from precision health insights. If we empower the physicians also through continuous education, they can understand how to interpret these kind of latest, genetic test results, or how to utilize the digital and AI tools. And most importantly, they can communicate with clarity and confidence to patients so that, they can build this kind of trust between the patient and physician. So basically, health literacy and education is fundamental here, and that is the bridge that is connecting between the innovation to impact.
I think that's very critical. Health literacy, I like that word. Albert, just coming to you, Vidya just touched on a little bit around continued medical education and its importance to have multi-omics being implemented into the clinic. Could you touch a little bit around how some of the LLM models we have, like M42, are really helping physicians understand very complicated reports, and how it will really facilitate this hyper-personalization of medicine?
So just going back to some of Vidya's comments, I think it's really important to understand that the only way to make personalized medicine a multi-omic approach is to democratize genomics and multi-omics, build insight generation that is sitting on top of all these data sets. The genomic data sits alone, is very powerful, but not as powerful as it integrated within the health medical records. It's critical to have that genotypic-phenotypic correlation and to expand across the medical records through longitudinal assessment of that particular individual to see over time how changes in their biomarkers, changes in lifestyle has impacted their health and well-being. The whole concept of humanizing healthcare is very critical. The way we can give back time for physicians to really enable them to treat our patients, but more importantly, change the narrative from patients to go back to citizens. We don't want people to come into hospitals. We want to find ways to predict and prevent disease. And there's many applications that we can use using the multi-omic approach, but this can't be done in isolation. It has to be linked with multiple data sets. That's why using large language models helps simplify and access that information at a touch of a button. But more importantly, I think you asked a question, Sid, about physicians. I would take it to the next stage. I would say we need to empower our citizens. We need to build genomic literacy and health literacy within our populations. And the only way to do this is to take the new age of communication. How do we communicate today? It's all chatbots, it's through social media aspects. We need to apply those type of advancements in communication and AI tools of large language models directly to our citizens, to our physicians, so they can be empowered to make those decisions on very complex data sets, very complex genomic reports, and link all those data sets together to build a very simple, progressive way of dealing with their own health and well-being, to hopefully have the level of information empowerment to make those lifestyle well-being changes. Globally, we're spending over $1 trillion on preventable disease. And by definition, this is preventable. Very small, I would say, a small prevalence of diseases are related to inherited disorders. The vast majority are related to environmental, preventable disorders. So we need to focus on how to improve that through the multi-omic approach and empowering our citizens to make those decisions.
Thank you, Albert. I think Albert touched on a great point about empowering populations, right? So before we go on to the next question, can I have a show of hands at how many of you have got some kind of a wearable device on your hand which is monitoring steps and other health parameters? So that's roughly about 40–50% of the people here. That's really interesting because Albert talked about empowering populations, and I think wearables are one part of the puzzle. But to go to the next level, we need this wearable data to be augmented by other data sets, which is your multi-omic data, which is your clinical data, all of that augmentation going into a central repository. Laurette, can you explain to us how that could work? We've got Malafi, which is a centralized health exchange, and adding wearable data, how would that work within the centralized health exchange?
So as you know, we have Sahatna, which integrates with wearables. And I think the next level will really be marrying all of the data we get from wearables, from the environment, to the phenotypic data, as Albarah mentioned. And the real value in that, as my colleague mentioned, is the longitudinal component of that. And with that, we can start to understand, if we adopt a developmental origins of disease approach, a life course approach, that there are critical periods where specific exposures can augment your risk for disease development or disease progression. And this is something that I think where the real power of Malafi really lies, and with the right support from the right stakeholders, this is hopefully the next step that we will take. And it will help us to develop interventions in a more precise way. And this is where I'd like to introduce the concept of precision public health. So this is something that is an evolving discipline, and it involves the interplay and the integration of genetics, our lifestyle, and the environment to really deliver the right interventions at the right time to the right people. And the Emirati Genome Project and all of the multi-omics data that we're collecting really provides a real opportunity for us to develop this in Abu Dhabi.
Thank you. Javier, over to you. So we've talked about integrating into multiple data sets, inclusive of variable, which is another data set that you'd have to look. As a bioinformatician, what does it mean to amalgamate all these data sets, and how easy or difficult is it to then turn these into risk predictors?
Well, it's going to be not easy. I think I envision a future in which when you buy one of those wearables, for the first 2 or 3 weeks, it's going to be like recording certain metrics to have a basal levels. And from that, it's going to start giving you insights. Like, for instance, maybe you are like HRV is going up, etc., because you're training, etc. I think that's what I would love to see in the future, that as the cost of doing those multi-omics analysis decrease, that's something that maybe you can do regularly, every month or every 2 months, and then that can be fed into the wearable and be combined, and then giving you insights about your current status of health and training. But obviously that's going to be challenging because, like for proteomics, as Albarah was saying, like 23 genes, you're going to have this many readouts for those proteins. Methylation is a bigger beast. You have around 30 million sites that are potentially methylated, and you need to combine that information. So it's going to be challenging, and there is where AI and LLMs probably can model to lead to interpretations.
Okay. Albarah, we've got a couple of minutes left. One question to you. If you had a wish, what would be that one wish that you would make on this journey from healthcare to health?
It's a good question. It's a bit deep for you, Sid, but I'll try my best. So I think for me, it's stopping disease before it happens, and I think it's not managing disease. If you in your opening remarks, you mentioned the NHS, and it's a very sad point for me as well, because I worked in the NHS for many years. And to see a system that was based on integrating best practices sort of deteriorate. And I think the reason for deterioration is because the burden of disease is increasing. Our lifespan is increasing, but our health span is not increasing. And I think that's a critical component here. We have people living longer, but with serious disease and comorbidities. And that's a burden on the healthcare ecosystem. So we need to prevent those diseases. So we have that, the buzzword longevity. Reality is longevity is great, live longer, but we want people to live healthier, better. So the health span is very critical than the lifespan, in my opinion. So my wish is to really look at preventable diseases, have an augmented, integrated data set that gives us real-time insights into our well-being, allows us, to Javier's point, now we're wearing wearables. I know when I wake up in the morning how my recovery was the last night. And honestly, that's empowered me to start thinking about those decisions. What did I do last night to be able to change my lifestyle habits, to improve just my sleep? So if I can do that across the board on everything that I do, and those preventable diseases decrease significantly year on year and improve people's health span, that would be my ultimate dream.
Perfect, thank you. And I think, thank you, everyone. I think it was a great discussion. I just would like to close and say, I think taking care of our own health is not just in our own interest. I think it's in the interest of the entire population, because health systems need less and lesser people to come in. AI, multi-omics is going to help us on that journey, but ultimately the ownership lies on us to go get our regular screenings done, make sure that we do what we're prescribed, and make sure we lessen the burden on our doctors and our nurses, because they're there to take care of the really sick. With that, I want to say thank you, everyone, for being a great audience, and hand it back to Amandeep.